Recently, a teammate of mine over the age of 50 asked for some practical tips for staying healthy. I'm 55 years old myself, so I'd like to give some bullet points. Number one, when you're over the age of 50, respect the physiology. Our anterior pituitary gland doesn't produce and release as much growth hormone as it did 30 years ago. Our gonads don't produce and release as much testosterone as they did 30 years ago. The 5 major parameters of athleticism, strength, power, flexibility, aerobic and anaerobic capacity, diminish as we age. Respect that. Our theoretical maximum heart rate, 220 minus our age, diminishes as we age. If we're rolling with a 20-year-old who has a theoretical maximum heart rate of 200 and he or she can redline to 90% of that at times, that's a huge advantage over someone who is 55 years old and maybe can redline to 70 to 75% of his or her theoretical maximum heart rate per minute. Secondly, pull all the levers that you can to keep that physiology as high as possible. First, a high-quality diet to include at least 0.8 grams per pound of high-quality protein, grilled chicken breast, fish, high-quality meat, protein powder, etc. At least 0.3 grams per pound of fat. Our body needs fat to produce hormones such as testosterone and growth hormone. Number 3, high-quality carbohydrates, fruits, vegetables, and whole grains. Next, ensure adequate hydration. There is a formula called the Holiday-Seeger method that calculates baseline fluid needs for human beings of all ages over the age of 2 weeks old. I have an older video on my channel. Adequate hydration is very important. Next, high-quality sleep. High-quality sleep is the second most powerful anabolic stimulus except for genetics. Genetics is number 1. The vast majority of growth hormone is released during high-quality sleep, and the vast majority of testosterone is produced during high-quality sleep and released in the early morning. Next lever you can pull is a high-quality off-mat strength and conditioning program. This doesn't have to be anything fancy. For jiu-jitsu athletes, upper body push, like bench press, upper body pull, such as a seated row, shoulder press, squats, and lunges are more than enough. If you don't have any equipment, push-ups, dips off a chair, body weight lunges and squats, and crunches are more than enough. You can online search full body weight exercise program, and there are tons of reputable websites that will put together a high quality non-equipment based program for you, or equipment based also, for free. On the mat, the most important thing is to train with safe training partners. In my humble opinion, a safe training partner has 3 things. Number 1, the neuromuscular control to move in jiu-jitsu ways at all times, and it takes months to develop this neuromuscular control. Number 2, the emotional regulation to use that neuromuscular control, not to become angry because he or she can't tap you and start spazzing out. And the third component is a willingness at all times to employ the emotional regulation and the neuromuscular control to move in jiu-jitsu ways in order to keep himself safe and his training partner safe. Next, when you're on the mat, if you're over 50, focus on movements and combatives that keep you in proper alignment at all times, base posture, structure. Professor Robert Bernanke of Island Top Team in Vancouver, Canada is a big proponent of this. Look up his videos, they're excellent. For students of our age, an Imanari roll into a leg entanglement is not the most optimal technique. Things like techniques that involve 2 to 4 steps that keep you in proper alignment, such as arm bar from closed guard or the elbow escape from bottom mount. Things like this that keep us in good alignment. If you're stuck in a bad position, in bad alignment, let's say as an older student, you're in bottom cross-eyed and your opponent is laying a brutal cross-face where your face is looking the other way. Your vertebral column is rotated at the cervical level, at the neck level. For the love of God, don't try to escape from that position when you're in poor alignment. Either fix your alignment first before you escape, or just stay there. Or if you're uncomfortable, tap. There's absolutely nothing wrong as an older student over 50 to tap, to pressure, or when you're in bad alignment. We have to remember our bones, our discs, our ligaments, our tendons are all 50 years old or older. They're not young anymore. The next thing on the mat is monitor your stimulus to fatigue ratio very carefully. Stimulus, of course, is the training that you're doing to stimulate growth and improvement. Fatigue is the fatigue level that you feel. And fatigue can be in the tissues, such as the muscle, the connective tissues, ligaments, tendons, and even bones develop microfractures with training. And then there's central nervous system fatigue. And they all accumulate and resolve at different rates. So, for example, if you're training twice a week jiu-jitsu and you bump it up to 3 times a week, and a couple weeks later you say to yourself, boy, I'm improving by X%. That's great. But if your fatigue is accumulating at 3X or 5X, that stimulus to fatigue ratio is going to pot. You may have to back off back to 2 times a week until either permanently, because that's all your body can handle, or until your grappling fitness improves, and then you can bump up to 3 times a week. What we want to do is we want to stay between minimum effective volume. Minimum effective volume is the amount of training and the intensity training that we do per unit time to at least maintain our skill set. And the top of that would be maximum recoverable volume, where that's the top end of training volume where you can actually recover without injury. We want to stay above minimum effective volume and below maximum recoverable volume, preferably closer to minimum effective volume as we're older. After training, don't be afraid to take a dose of Tylenol and or ibuprofen together if your physician allows it. This will help with pain and inflammation immediately post-training. At our age, a high-quality multivitamin daily is a good idea. Certainly, if you want to try creatine powder, protein powder to make sure you are taking in enough protein, that would be fine also. The next thing is, at our age, deal with injuries properly. Okay? If you can, see a medical professional if you suffer an injury for a proper diagnosis. And then a proper physical therapy program. Physical therapy has 4 goals. Number 1, downregulate pain and inflammation. That you can do with rest, ice, etc. Number 2, regain proper range of motion in the joint for the activity that we want to engage in. Next, regain proper strength at all proper ranges of motion for that joint. And then number 4, a gradual return to full activity. Ideally, if you can, find a physical therapist who also trains Brazilian Jiu-Jitsu, because he or she will understand the unique forces and tension on the joints. Next, don't be afraid to take rest days to dissipate fatigue, where you take the entire day off, or you take a light walk and some light stretching. Light sessions, which is decreased volume for 1 day. Deload weeks are very important, where for an entire 7 days, you cut your volume in half. That means intensity and time in half. You will not lose gains with a 1 week deload week. And many elite athletes will take an active rest session, which is 2 to 3 weeks of either doing nothing or 1/4 to 1/2 volume, and that's called an active rest session. Last thing I would say for anyone over the age of 50 is, if possible, see your primary care provider for a physical exam with full labs and a medication review on a yearly basis. Vital signs are vital signs for a reason. If your baseline blood pressure is running 150 over 100, you're not going to feel well. You're not going to perform well. That may need to be addressed. A CBC, CMP lipid panel, TSH, and a PSA may be appropriate, because metabolic causes of poor performance can include anemia, prediabetes or frank type 2 diabetes mellitus, electrolyte disturbances, hypo or hyperthyroidism, etc. And if it's a metabolic issue that is causing you to not train properly or not recover properly, perhaps that can be corrected. And finally, a medication review. You would be amazed how many medications can trigger side effects like fatigue, sedation, etc. Over-the-counter sleeping tablets, prescription sleeping tablets, beta blockers for high blood pressure can throttle back maximum heart rate. Cholesterol medications can trigger myalgia, arthralgia, muscle aches, joint aches, and many, many more. So those are some quick thoughts. I'm sure I've missed hundreds of other things, but I would say the most important thing would be, number 1, safe training partners on the mat, and number 2, monitoring the stimulus to fatigue ratio very carefully. And if fatigue accumulates, try to dissipate that with either rest days, light sessions, deload weeks, etc.